Give him a seat, yes.
We're here with Doctor. Would you state your name, please?
Oscar Quijano.
Oscar Quijano. You're an MD?
I'm an MD.
And Gail Thornburg is your patient, is he not?
Exactly right.
He's a Parkinson's patient. Now,
I've
did
known
you
him for a long time.
You wrote the prescription for the NeuroCare treatments.
That's
Now,
right. Yeah.
you saw him after his first treatment. Can you tell me what you observed after that treatment?
Yes. After the first treatment, we were invited to see him, and we had dinner together. And I was so amazed. There was no shaking, no tremors on the hands, and he was looking just like normal person that has no Parkinson's disease.
What was his reaction to this?
They were so amazed themselves, and they were so thankful that this machine came about their life.
Have you ever seen anything provide such a benefit for a Parkinson's patient?
I've never seen this kind of a response with medications that I know of.
How do you respond hearing that their medications are kicking in 5 minutes instead of an hour because of the use of this?
That's almost like a placebo effect now, because it doesn't get absorbed at least for about 20 minutes in the stomach, unless it's an oral it's a sublingual medications, and so I don't think a 5 minutes window in there is enough for the medicine to get absorbed into the system.
How do you respond when people say that the NeuroCare increases circulation throughout the body, so that we will actually help, whether it's 5 minutes or 20 minutes or whatever, we will help people feel the benefits of the drug faster?
If that bears out, then I'm really be impressed beyond belief.
Do you think that the increased circulation could have something to do with the reduced shaking and the improved efficacy of the drug?
You know, it could be, but it'd be neuromuscular. It's a neuromuscular disorder, and we don't know the real cause of Parkinson's disease. But to me, at this point in time, I'm still unsure how the
what the
mechanism of remediation into the symptoms of the patient.
Let me ask you this: if it worked on every one of your Parkinson's patients, and you could never figure out, maybe it was a placebo effect. Who cares?
Who cares if it's working? That's exactly right. That's exactly right. But I was tremendously amazed and impressed because that one treatment alone could not have prevented the shaking, because I've never seen Gail. He's a very close friend of mine, and I've never seen him not shake at all. There's only a moment or two that he doesn't shake, but throughout our visitation, he's always tremulous. And so this time we had dinner, and I spent about 2 hours at that evening, and no shaking at all.
Did they talk? Did Esther, his wife, just told us that he used to have a real struggle with depression, and that he's totally, it's like the old Gail's back. He's not depressed at all.
Yes, and that's very true.
Have you seen that side effect from Parkinson's drugs before?
I've seen that. That's not uncommon at all.
How do you feel knowing that we have a program that can help people overcome depression?
Well, I'll tell you, if it bears out in the many patients that we would be trying on it, then it's a miracle and it's a wonder that we have something that we can offer to this patient.
What's interesting is, beyond the Parkinson's issues, the gentleman has neuropathy. He had horrible itching in his leg. Esther and Gail reported that the itching is completely gone in his leg. In fact, the worst leg we treated has now become the best-looking leg. So we notice pitting in the other left leg that hadn't been treated. So
that is just wonderful and very amazing. And I tell you, I'm very impressed with the machine.
Doctor, I want to give you some inside information, but it's a warning. A warning.
Okay.
I understand that you and Mr. Thornburg were golfing associates in the past.
Exactly, yes.
When we went over there to do the video.
Right.
He was in the garage cleaning his golf clubs. So get ready.
Let me tell you what's funny about it.
That's good.
If you help people get rid of their depression, they appreciate it. If you help them get rid of their neuropathy, they appreciate it. But if you give them their golf game back, they'll love you forever.
That would be the cream of the crop, the icing of the pudding, right? I totally agree with that because they get their quality.
Well, if you think
life.
about it, quality of life improves significantly with NeuroCare. The efficacy of the drugs they've actually cut out. One of the drugs they reported they cut out completely.
The Mirapix is the one that they cut out.
And you've read the JAMA articles about drug toxicity, so one less drug in the drug cocktail can only help us reduce drug toxicity.
Amen to that.
Amen to that.
Yeah.
Thank you so much for your time, Doctor. We sure appreciate it.
You're very welcome.